these two cycles are often separated, what we also call as segmentation of IVF. The ovarian cycle is important for me to learn about ovarian stimulation, followed by ovarian or oocyte pickup. And this endometrial cycle is important for endometrial preparation. I'm going to be talking about all of this today. Endometrial preparation, which will lead to eventually embryo transfer. So basically, these are the two terminal events in these two cycles that have to be spoken about. Of course, the embryo transfer, I'll talk about it, can be either a fresh embryo transfer or it can be a frozen embryo transfer. I'll talk about that as well. But this is a basic that you need to understand about this thing. And when I'm not keeping these cycles together, that is called as segmentation of ART cycle. Segmentation is basically in one cycle, I'll be doing an ovum pickup, and in the second cycle, I'm going to be doing an endometrial preparation. This is also, of course, going to ensure that it is going to be a frozen cycle that I'm doing, which is what is preferred now. Don't think about all this now. We are first going to be talking about all things that are about physiology. So if you all have any doubt, please let me know in the chat. I'm just having a look at the chat section. If you all have any doubts, quickly let me know. So now, if you all have any doubts, please quickly let me know in the chat. So I've already told you what does ART do. So physiology था, but ART ने उसको amplify कर दिया, 1000 गुना बड़ा बना दिया. So what is the major difference between a physiological cycle and an ART cycle? So there are a few differences that I need to know. So in a physiological cycle, physiological is basically a normal cycle wherein you're not giving drugs, a natural conception. In that, the most important point is there is a monofollicular development. So monofollicular मतलब एक dominant follicle बनता है. Whereas in an ART cycle, you have multifollicular development. So there are multiple follicles that become dominant follicle. That is a very important point that you need to know. Apart from that, there is a gradual development of the endometrium, or endometrium prepares itself very gradually, whereas over here it is a completely artificially stimulated endometrium that is a little more rapid than your natural.